is Ximena Jordan Bruno. I'm a hematologist that works here at Penn. I treat myeloid malignancies ranging from myeloproliferative disorder to acute myeloid leukemia. And my research interest and passion is to investigate when leukemias run in families, meaning hereditary risk of blood cancers. When I was a fellow in the University of Vermont, I took care of a very young patient. She had sarcoma when she was really young, in her 20s, and then afterwards was diagnosed with a therapy-related myeloid leukemia. And I took care of her for the whole time that she was sick. And there was always this question in my mind that there was something else behind her disease, not only that she received therapy for her sarcoma, but there was something genetic in her condition. We did some genetic testing. We eventually sent some samples to the University of Chicago, where she was able to be diagnosed with a condition called neurofibromatosis type 1, which is the reason why she had sarcoma at such a young age, and then developed this very aggressive leukemia that unfortunately took her life. The way my team is working is we're trying to collaborate with scientists, initially in the United States. We have a biobank, a biorepository that is very different or unique in the sense that we don't really have the control of the samples. We storage the samples and we work with families and patients and the RRP. Then eventually we're hoping that we can streamline the process of sharing samples with the goal that somebody has a great idea, then we can collaborate at least with sharing samples. My job and my desire to help my colleagues who treat leukemias and myelodysplastic syndrome to include in their assessment and include in the risk and include in the factors that they have in mind when they're planning a treatment, to consider that RUNX1 and other mutations could be the underlying factor or one of the factors that could have played a role in someone developing this malignancy. I think one of the most interesting questions I think that several people around the world are trying to find the answers is, can we prevent? Right? Is there something that we can do to prevent for these conditions to ever happen in the first place? This dream that we all have of preventing leukemia or preventing myelodysplastic syndrome. I think all clinicians who work in leukemia know how hard it is for patients and their families to deal with these conditions. It's a 360. Everything is around the disease itself. It really affects their quality of life, of course, and it can shorten their life as well. So if there will be a time where we can say to people, we could try this medication and maybe can we prevent or delay the development of leukemia, that's for me the most exciting. I think people should really consider donating to the RUNX research program. It's a foundation that is really focused in the patients and their families and how to better serve them in their wishes and in their care. That approach, I think, is unique, and I feel very privileged to work with them and for them.